so we can give them money away. Okay, I'm ready to give away some money. Some money, okay? I make it, just, I feel like I'm gonna make people angry. Let me say this again. Welcome back to my channel. For those who don't know who I am, my name is Mpho Bubbly and this is my channel, self-titled. If you are a returning subscriber, hey there, like, glad to see ya, glad to see you coming back. And if you are a new subscriber or a new viewer of this channel, I really hope that you like it here. Like, maybe something will give you a bit of motivation to subscribe and to stay in this family. We are currently on the road to 2,000 subscribers, and I have a really important announcement with regards to that at the end of this video, so you should probably keep watching until the end. Thank you so much to everybody who is already subscribed, and there are some of you who just watch but you don't subscribe. I just make it make sense, because you clearly like my content, you watch the videos, but you don't subscribe. Why? Because if you subscribe and put on your post notifications, you'll know every time I drop. You don't have to like just guess if I dropped or not. You know what I'm saying? So please subscribe. I'm actually going to give you a minute and I'm just gonna let you subscribe. Like, this is your moment, subscribe. Cool. So in this video, I realized that in as much as I started YouTube to make videos for my subscribers and to entertain and to give information, I also wanted to sort of make it a personal diary of my journey through medical school. So I'm making one of those videos today because I remembered. So I just finished a block this year, my first block, and that block was surgery. And I'm just going to be reflecting on it, talking about what it is that surgery is, how it went, and what I think I learned from the block, and what it is that I think that I could take into the next block and also just carry with me for the rest of this year. So if you're interested in hearing all about that, or if you're in clinical years or you're about to be in clinical years, I think this is a very interesting video for you to watch. So keep on watching. So the year is 2021 and I just finished my first block. My first block is called surgery. I think every med school has it named as surgery. So surgery basically is exactly what it says. It's just the surgery department. You learn about all types of illnesses that are treated via surgery, and then you don't really necessarily learn how to do the surgeries, but you learn how to manage the patient before they go into surgery and get taken over by the surgeons, so that the patients don't demise before they make it to the surgical table. That's what they teach you basically as a student. It's so that as an intern you are able to manage the patient as they come in with conditions that are probably surgical and need surgical intervention, but you need to be able to stabilize them, because patients can't go into surgery in pain or in with their electrolytes imbalanced or hematologically imbalanced. So you need to find a way to balance them and also to make them comfortable in order to go into surgery, because they can't go into surgery while they're still in sort of a traumatic or shocked stage. So that is basically what surgery is. So what do we do in surgery as students? You do the ward work, you take bloods, you clock patients, you take patients up for scans, you can read the scans as well. You need to know how to do that. You then also learn how to then treat the patients. Not necessarily fully definitively treat them, but treat them and optimize them to the point where they can go in for surgery. So how did I find it? I have been struggling with surgery since I started doing it anyway. Surgery is I'm trying to find the right words. It's not difficult, but it isn't easy. So what I like about our department at my school is that they teach in surgery in particular, I'm talking about the surgical department. They teach, they make sure that they teach, they make sure that the timetable is very clear, that you do your hours in the hospital, that you do go to the wards and you do things that need to be done, and that you do clock patients and you present them to the doctors. So you get a lot of exposure in terms of that, and you get a lot of tutorials and teachings in terms of that. So they make sure that you get the information. It is then up to you to go and also consolidate that information and also look for more information, because sometimes, again, doctors are not perfect. Doctors are not, they're not all knowing. So you also need to, when you hear things from the doctors, you also need to go back, open your textbook, do your own research, and also just consolidate that information so that everything comes together for you in your mind. So that's what I really like about our surgical department, and it is huge. There are so many people to ask, so many people to talk to, and so many different doctors that teach differently and that can tell you something in a different way that might make it easier for you to understand. So I really, really love that. Also, if you didn't know, we have the best surgical department in the country, but we're gonna go past that because people like to fight and I'm not ready to fight. Okay. For me, surgery is one of those modules that I've always struggled with anyway. I can't tell you why. I don't actually have a reason. I actually really enjoyed it this year in comparison to when I did it before. It is a very hectic block. It's one of the more hectic blocks in your block system. So when you're doing surgery, you're going to feel that you're doing surgery because there's calls, there's going to hospital, there's classes. Like we would have classes, if you guys saw my first vlog, which you probably should have watched by now, but if you didn't, I'll tell you again. We had classes from 7 in the morning till 7 in the evening sometimes, which that means that is 12 hours of classes. Sometimes it wouldn't even end at 7 in the evening. It would actually end at like 8, 8:30 in the evening. So meaning I had 12 plus hours of class every single day. And I don't want to say when I'm in the hospital, it's not counted as class because I'm still learning even in the hospital. So you have to go back every single day, Monday to Friday, with those 12 hours and consolidate that information and make sure that you actually know that information. But it is drilled into you so many times because common things occur commonly. I don't know if you guys have heard that saying. So the more common things, you know them like the back of your hand because they occur so many times that you see them so many times that you actually just end up knowing them. But the more obscure things, you need to go and sort of read around them because they could also come out in the exam. Yes, they like to bring out the more common things, but sometimes they can bring out the more obscure things that aren't as common but that still occur. So you need to go out and learn that. But it wasn't too bad. And then we'd also have classes on a Saturday at 7 o'clock every single Saturday for 2 to 3 hours. Sometimes we'd have 2 classes. So after the 2-hour class, there would be another class for like 2 hours. So that was a bit hectic. And I think we also once or twice also had a Sunday class. But I mean, that's the thing. You're here at school to be a student. So sometimes you just have to suck it up and do the work. You understand what I'm saying? And calls also, you do call sometimes on the weekend, on a Saturday or on a Sunday. So you just have to suck it up and do the work. And like I said, surgery is one of the more hectic blocks. So there you do really find yourself giving up a lot more, giving up a lot more free time, so to say. You find yourself doing a lot of things at the same time. I was eating very poorly. I was eating mostly takeout for their entire block. If I didn't take food from home, I maybe cooked, I think once in the entire 7-week rotation. And then the other times I was just eating takeout because I just felt, maybe I was also just putting a lot of pressure on myself. I just felt as though there's no time for me to do certain things. The other thing that really helps is having pre-made foods that you just warm up, and also having like oven foods like chips, nuggets, and things like that. I usually would eat that if I'm not getting takeout. So that really, really helps. But yeah, I think it was a really, really good block this year in particular compared to the other time that I did it. So I am pretty like stoked with how it went this year. I don't think it was too bad. So then at the end, we have an assessment. The assessment, ours is 3 parts. So we had 4. So we had an MCQ, which was for general surgery. Then we have a test for all the subspecialties in surgery, which is your pediatric surgery, neurosurgery, cardiothoracic surgery, and plastic surgery. So they all had their own tests that they also set for us that we wrote as well. So it was 4 tests. And then we also had a radiology exam, which is where they bring up, again, the imaging. So they'll bring up an X-ray or a CT image or an MRI, and then you have to interpret what you see on there, which wasn't too bad really. And then the last one is an oral where you get 4 cases, and in the 4 cases you can literally get anything. You walk in there, they give you a scenario or like a sentence of what's going on, and then you start from the beginning with managing the patient. So that is the assessment, and it really wasn't too bad. It's just nerve-wracking because obviously you know that your fate is in the hands of the person you're speaking to, and you need to speak some sense. So if you go in there not knowing your stuff, it's really easy for the doctors to see that you don't know, because also they know that you're nervous, so they are trying to help you by giving you more. They sort of lead you. If they can see that you're sort of taking a while to get into the swing of things or into the rhythm, they ask you, are you sure? Or they try to like show you that you're going on the wrong route. Let's bring you back over here, which is fine, because as an intern, you're not necessarily alone. You are also going to have superiors. Yes, you manage the patient, but you are going to have superior people that come in and check on you and make sure that what you're doing is correct, because technically you're still in the process of learning. The other thing I just want to mention is that in surgery, one thing that it did do to me in particular this year is that I felt myself losing confidence in myself in the middle of the block. And that's something that can never happen, especially for assessment. You cannot lose faith in yourself, because the doctors also have this thing, I don't know if it's just our university, where they'll ask you, are you sure? And if you're not sure, it means that you're also not going to be sure when you're managing the patients. So when they ask you, are you sure? They don't mean, are you wrong? Or that you're wrong. They just want to see that you are going to stick to your guns and that you're sure of what you're saying. So if you're unsure of what you're saying, then you're going to end up saying, no, actually I'm not. Or you're going to end up doubting yourself. So you need to have self-confidence. And I felt myself starting to lose that in the middle of my block. And I just didn't understand why. Like, I just couldn't figure out why I was losing confidence in myself. And I understand that maybe because sometimes they'd ask me a question and I wouldn't get it right, and I'm generally a person who beats myself up if that happens. So I would go back, study it, and then come back and make sure that I know it for the next time. But still, I was losing this confidence in myself, and I had to sit myself down and say, listen, this isn't going to work right now. You need to get that confidence back, because that oral is coming and they are going to ask you those questions, and you're going to have to be sure when you're answering them. So that is something that I just want to say, that you need to be confident in your work. And the only way to be confident is to make sure that you know the work and that what you're saying is the right thing. Because if you're not sure, they are going to ask you. I've been asked this in almost every single OSCE I've ever done. Are you sure? Because they just want to shake you a little bit, just to see if you really are sure of what you're saying, and that you're not just guessing and hoping that it's the right answer. So if you are going into surgery, or if you are in surgery right now, my advice would be to keep your head down and just get the work in. And surgery is very repetitive in that the treatment is very like the same for a lot of the conditions. It's very like rehydrate the patient, fix the electrolyte imbalance. You know what I'm saying? There's just a few, like you just have to either add or subtract certain things for other conditions. But if you have a general framework of like resuscitating a patient, it's sort of the same thing over and over again. You just add and subtract certain things depending on certain conditions, but most of the time it's the same. So get the framework together and then just know when to add and when to subtract certain things. And also just sacrifice for now, because surgery takes a lot of your time. And just sacrifice for now, and you'll see that at the end, you're going to end up knowing all the stuff. And yeah, that was pretty much my surgical rotation. I'm currently doing another block, which I obviously, as I finish blocks, I will tell you guys about how it went and what exactly it is and how it went and stuff like that. Also, if you're in my university, definitely DM me. I can send you some material that I might have for certain things. Even if you're not in my university, I guess, you can DM me. Maybe you want just some extra material just to use. You can DM me. I can send you some extra material that you may not have. And then we can take it from there. But really, that's surgery in a nutshell. And I can't really say much more. Back to this part of the video, that means you know that something is coming. And this is me about to announce something that I'm really excited about. For those who don't know, this channel's birthday is also my birthday. So on the 15th of April, this channel will be turning 1 year, which is pretty soon now that I think about it. But I figured that I have to do something to celebrate. So For the channel, I decided, since we're turning 1 year old on the 15th of April, the aim is to get 2,000 subscribers by then. And if we don't, then whenever we do get 2,000 subscribers is when I'll be announcing the winner of this particular giveaway that I'm about to announce. So the reason for this giveaway is that we're turning 1, but also I did promise a 1,000 subscriber giveaway, and I still haven't done that, just because what I wanted to do seemed to be putting myself and other people at risk. So I didn't want to do that, because I can just do that when the country's fully open again, and then we can just all meet up and talk to each other and things like that. I wanted to meet some of my subscribers. So what I'm going to do for this giveaway is, it is a cash prize. I will be announcing the amount of the cash prize on my Instagram, and closer to the time of when we reach 2,000 subscribers. And for now, to enter the giveaway, you need to be following me on Instagram. You need to be subscribed to this channel that you're watching right now. You also need to share a post that I'm going to put up on my Instagram.
Hey you guys, this is future Mpho, and I'm realizing that I neglected to mention that you need to tag 2 of your friends in the post that will be on Instagram. And when you share, please don't forget to tag me so that I can see it. And good luck to everybody. Bye!
Share the post, tag me as you're sharing it, subscribe to this channel, be following me on Instagram, and help us to reach 2,000 subscribers. And as soon as we reach 2,000 subscribers, the winner of that giveaway will be announced. I will announce the amount of the giveaway on my Instagram, so stay tuned to my Instagram. Go and follow me on Instagram if you haven't been doing that. And that is essentially the giveaway. I hope you guys are going to enter the giveaway and that you enjoyed this video. I love you all so much, and I am so appreciative of you watching this channel. Don't forget to subscribe, like, and comment. Still, we're on the road to 2,000 subscribers. Well, that's where we're announcing the winner, and I hope we reach that pretty soon. So until the next video, hasta la vista. Love you.